Timor-Leste is a small country in Southeast Asia which occupies the eastern half of the island of Timor, 700 kilometers north of Australia. Bairo Pite Clinic is a non-governmental organization located in Timor-Leste's capital city of Dili. It was founded in 1999 by an American doctor, Dr. Dan Murphy. The clinic provides free healthcare to all patients and sees more than 250 patients daily, with 55 inpatient beds and many programs including maternity, malnutrition, dental, HIV, TB, and mobile clinic. The vision of Bairo Pite Clinic is simple: to improve the health of people in Timor-Leste. Timor-Leste ranks 134 out of 186 countries in the United Nations Human Development Index, and almost half of the population live below the national poverty line. One of the greatest challenges facing this nation is TB. TB is common in Timor-Leste. It has the 8th highest incidence of TB in the world, and every year, around 1 in 200 people will become sick with this disease. At Bairo Pite Clinic, more than 1,000 cases of TB are diagnosed and treated every year. With such a busy program and limited human resources, delivering our TB program is challenging. But Bairo Pite Clinic wants to expand and improve our program further.
So TB is a disease which is spread by coughing, and when you have close contact with other people, particularly when you're living with other people, those people are actually at risk of catching TB if you're coughing out the contagious form of TB. And small children, particularly children who are under 5, are at particularly high risk of getting TB when they're in contact with someone with TB. And not only that, they're more at risk of developing severe forms of TB such as meningitis. So it's really important that we try and see these children and that we examine them, we ask questions to see whether they're sick with TB. And if they are sick with TB, they need to be treated. If they're not sick with TB, there's a window opportunity where we can actually give them a medication called Isoniazid that prevents them from becoming sick with TB. And this approach is endorsed by the World Health Organization. So the process to actually get them on that medication is that we have to contact trace. We have to ask people who are sick with TB, who do you live with, how old are they, can they come to the clinic for us to see them? And then when we see them, we ask questions about how they are and we examine them. And if they're unwell, we give treatment, and if they're not unwell and they're aged under 5, we give them the Isoniazid Preventive medication. And that process sounds like it should be quite simple, but when you're actually working in an environment that's very resource poor, particularly poor in terms of human resources that are available, it's actually very difficult to adopt that approach at a programmatic level. So we started the process of trying to provide Isoniazid Preventive Therapy in August 2013, and at that time it was being led by a single doctor and the 2 members of the TB programme department. And we started contact tracing and giving written and verbal advice to bring all children aged less than 5 and anyone in the household who was unwell to be seen by the doctor. And we had some success, but it became very apparent over the course of the next few months that we were getting a limited success with this. So only about 25% of the child contacts aged less than 5 were actually brought to see us at the clinic. And of those children who went on to start Isoniazid Preventive Therapy, a large proportion of them were lost to follow-up. And these problems are not unique to Timor-Leste. They're well described worldwide, really. And the factors behind that are very complex, as is most of healthcare. But it became very apparent that we were going to need a different approach, an innovative approach, probably an approach based at the community level involving healthcare workers.
So we designed a new initiative with the goal of breaking the wall between the medical care and patients and their family members. This initiative had to take the TB services available at the Bairo Pite Clinic and bring them out to the communities and right to the doorstep of patients' homes. And the best agent for making this possible is healthcare workers. When a patient is diagnosed with TB, the healthcare worker provides comprehensive education to the patient and asks for the information of people who the patient has been in close contact with. The healthcare worker then arranges for a home visit to provide TB education to family members and screens the entire household for TB. Anyone who has symptoms of TB or anyone under the age of 5 is brought to the Bairo Pite Clinic in a TB program car. This removes transport costs as a barrier for patients. At the clinic, these individuals are seen by the doctor and a decision is made whether to start TB therapy, start preventive therapy, or to do further investigation. When preventive therapy is started, healthcare workers visit their homes every 2 weeks to check for TB-like symptoms and side effects to the medication. If they find no problem with the treatment, healthcare workers provide the next medication supply and encourage the family to adhere to the therapy.
Ba sira pessoal saúde serninya suporta tratamento ba paciente ne bema moras sira lori ai moruk ba paciente ni uma no si atau cara ajuda paciente hemu ai moruk TBC to fulang walu o remata.
It may not seem like a groundbreaking idea, but the transition to this approach has not been studied before, and we are really happy to say that it seems to work. In just 6 months, 178 TB patients have been interviewed, 118 home screening visits have been conducted, 525 people have been screened, and nearly 90% of 184 identified child contacts in Dili have been screened. Of those, over 70% went on to receive the preventive therapy, and 13 children were diagnosed with TB disease and started on TB treatment promptly.
Lihusi tratamento e halo konseling, halo screening, bato familia nibeke paciente helah mutu maka ita tu dalam dia kita nibeke ita tu halo maka atu menos laos ita halo tratamento dit mai ita halo mos prevenção ba familia mesang iha labare kikuan mos iha yang membuat nibeke dalam mengetetan sintomas ita halo tratamento ini dalam dia nibeke ita halo tratu akara TBC
Bairo Pite Clinic is incredibly grateful to the English Family Foundation, to Project Plus One, and to the Australian Foundation for the Peoples of Asia and Pacific, whose funding and support of this program have really enabled an innovative solution to the problem of preventing TB disease in young children who are at risk. We've been extremely excited to see how effective the healthcare workers have been already in getting access into homes within Dili, Timor-Leste to provide screening for TB disease and to provide the preventive therapy that the young children who are most at risk desperately need. We are convinced that this model of home visit-based care has the potential to be applied in other settings around the country and also around the world where the delivery of preventive therapy to children at risk has proven extremely challenging.